Welcome to KernTax's Conversations That Matter. I'm Michael Turnipseed, the Executive Director of KernTax. KernTax hopes you find these conversations informative and worthy of your time and provide you some insight that you didn't have before. Our guest today is Dr. Anna Laven, the Executive Director of the Bakersfield Kern Regional Homeless Collaborative. Whew, long name. The mission of the collaborative is to put an end to homelessness in Kern County through collaborative planning and action. The members work toward housing first as a solution. When people are housed first, basic needs are met faster, helping them live independently and minimizes costs to the communities. Whew. Anna, thank you very much and welcome to Conversations That Matter.
Thank you, Michael. I'm really excited to be on the program today. So much appreciated for the invitation. Always excited to talk a little bit about this item with you.
It's really nice to see when Kern Leaders Academy people are taking over positions of power and stature in the community. So I'm glad to see things are working out well for you. First of all, tell us about yourself and how you ended up as the czar of the homelessness in Kern County.
Sure. So, Michael, as you know, I am from Bakersfield and grew up here and have had a number of experiences both in working in higher education, in public policy, and fiscal planning. And a lot of that work that I've been able to do has been focused on the startup and the scale up of programs. Most recently, I come from Bakersfield College, where I was tasked with managing and running the dual enrollment program. When I was there, when I first started, I know it's another one of your babies, and
one of my babies. Thank you.
So grateful for you're spearheading a lot of that work early on. And for example, with dual enrollment, when I came on board, we were serving approximately 300 students. 3 to 4 years later, when I left, we were the largest community college program in the state for dual enrollment, and we had hit our 10,000 enrollment mark. And so I think that the strengths that I'm able to bring really allowed me the opportunity to be selected for this role. And I can share with you too, personally, I have always been somebody who's been very mission driven, very much interested in supporting and making change in the community. Most of that work has been done in higher education, but part of this role really hits home for me. I have a family member who has struggled with being intermittently homeless. He's a veteran and has any number of other challenges as well. And, having gone through that experience as a family and trying to support this individual really, I think, gave me a stronger sense of mission and wanting to come on board to address the impacts of homelessness in my own community where I grew up. So I'm excited to be on board. I'm hit my 4-month mark, and we're definitely hitting our stride. So really, really exciting times for sure.
Got greeted by the coronavirus.
Yes. So I was 3 weeks in, and I was actually taking a tour at the mission when they were already installing hand washing stations. So the word that I have probably used the most in the last 4 months is pivot. Obviously, when you're trying to stand up programming and support efforts for people to be safe, and the main effort is for them to shelter in place, and they don't have a shelter, they don't have a place to call home, that creates and presents very unique challenges for sure.
So the collaborative's been around for 12 years. It originally got organized. Why don't you tell it how it originally got started, and then we can talk a little bit about what happened in 19 and the pivot in a new direction.
Absolutely. So the collaborative originally came out of some regional requirements from HUD, which is called a continuum of care, and that was launched in 1998. A lot of that work was originally spearheaded under the United Way, with the leadership of Harvey Hall, our beloved former mayor. And, you know, I have to give them a lot of kudos for a lot of the work and the foundational pieces that they really did put together. So they instituted a first 10-year plan to end chronic homelessness. That was developed in 2008. And now we have an updated plan with an independent organization that was established in 2019. And with my hiring as the first employee for that independent nonprofit, we are putting things together and really trying to continue to build from the foundation that was established and formulate additional strategic efforts to address the impacts of homelessness.
So this really is a new organization with a governing board and an executive board that were much different than before. Just shortly tell us what was the major change in the organization, the focus that was needed to make the change, and the new direction it's taking.
Yeah, so I think really this was a cry from the community as we began to see increases in homelessness here. And that started with our PIT count in 2018. Then we saw a pretty significant spike with the point in time count at 2019. That was a 50% increase. And even in 2020, we've seen an additional 19% increase beyond that. And so I think that really what took place was the community started to say, and the leadership heard, both on the city and the county side, this is their number one issue that they want to see addressed. And both from a compassion standpoint and from a personal impact standpoint, you know. And so they began to realize that while the United Way had acted as a fiscal agent, really what was going to be key to bringing the providers, the city, and the county together was that independent entity that could offer up staff to provide what we refer to as technical assistance, to have that data-driven approach, and to have a unique perspective on the strategies that are needed to reduce the impacts of homelessness. And so in 2019, and again, I have to give kudos to the city and the county and the providers for really trying to double down on what partnerships can look like and the strength of partnerships. And when you pull all of those folks together, really amazing things can happen. And so in 2019, they determined, the city and the county both agreed to jointly fund the nonprofit so that we could focus on the work that needs to get done, not on fundraising, which is a great strategy, and move forward with the hiring of a small but robust staff team to be able to support both the providers and pull together the city and the county in a way that had not been done before.
Obviously, in the fall of 18, Measure N passed at the city, and a lot of us thought sales tax would never pass, even though we tried. And I think it passed by 97 votes. But one of the main issues was we have to address the homeless problem. Yes. And we'll get into some of those outcomes a little bit later. So you're the executive director of this new baby, the new collaborative. So what is your vision for the collaborative? Where do you want it to be in 5 years or 10 years if you had your way and your magic wand to make it all work?
Well, my goal would be to work my way out of a job. My goal ultimately is to ensure that everyone in Kern County has a place to call home, and that they are over 1,000 folks who are what we refer to as unsheltered. They're living on the streets right now, that we are able to find places for them to live, a place for them to call home. And in addition to that, that we are focused on the prevention side. So the most cost-effective, to speak to your audience, Michael, the most cost-effective strategy is to prevent homelessness. Once someone enters homelessness, even the most cost-effective strategies can get increasingly more expensive and challenging to help somebody find that place to call home, right? So that would be my 5-year goal. And I am really lucky that we do have a plan that covers a number of those areas. And one of the things that I hope folks understand is that there's effectively three components to solving homelessness and reducing the impacts. One is that prevention side that I mentioned. The second is housing. So if we were to take 1,000 people off the streets right now, where would we place them? Where is affordable housing available? And so certainly some of those things we are definitely going to continue to focus on. And then the third piece is what we refer to as those supportive services. So many folks who find themselves on the streets do suffer from any myriad of challenges, including mental illness, physical challenges. And so those services are really an important piece to helping not only get them housed and into a place to call home, but help them continue to be able to live there and live there in safety and harmony with the community.
Obviously you just talked about the plan because we kind of know where we are. We have a dream where we want to be, and you have to have a plan to get there. So what are the goals and benchmarks? So a year from now, and 2 years from now, and 3 years from now, we know we're making progress in addressing this. What do you have in your mind as really the things we have to get, the foundation and then the walls and then the roof, just building this house to solve this problem?
Well, I have to give the collaborative quite a bit of credit. As you know, almost all of these efforts are funded either through the federal or state government. And we take the investment of those public dollars very seriously. And so does HUD, and so does the state. And so there is, I'm finding in my 4 months so far on the job, that there's considerable amount of data that's actually available to us. And so one of my goals is to really try to start to unpack some of the data. So we're starting to look at length of stay, how long does it take to get a particular sort of group of individuals through what we might think of as the pipeline into housing? What are some of the sweet spots, if you will, in terms of maximizing the dollars that are being put into these efforts? And so when we think about benchmarks, some of that is still under development, and I think rightfully so. We have an administrative analyst that we just brought on board who's really going to be charged with doing some of that deep dive work. But in general, what our goals include breaking down the various groups of homeless using what's called a Built for Zero model. And that's the national program that uses best practices to try to think through some of that work. And so, for example, when we start to think about veterans, when we start to think about youth, and we've already started to create some of those benchmarks for the next year in terms of reductions, how many folks do we want to get through various types of programs. In some cases, we're hoping to achieve, let's say, for example, an 80% housing rate, which is really quite high. Some folks have a fair number of barriers, or red flags, if you will. They're not, and require quite a bit of work to help support them getting into stable housing. And so depending on, sort of the group, if you will, we're trying to make some inroads into some of those areas. But we're definitely looking at those items very, very closely, Michael. And we're using that 10-year plan as a framework to continue to think about how to maximize the work that's being done.
So ultimately, it's a combination of plans, some that address the veterans, some that address seniors, some that address young kids, the 18 to 21-year-olds that just kind of fall off the map and aren't taken care of. They're not in foster care anymore, and they kind of had a tough time making it work. So far informed.
It's not a one size fits all. It's not a one size fits all, and I think we have to recognize that as well. That there is a uniqueness to each individual, and trying to unpack what their particular needs are with those support services is really key to our success also.
So after 4 months on the job, what's been the biggest surprise or the biggest challenge you faced in taking on this new job?
I think obviously there's a lot of challenges associated with coming into a new space, trying to do effectively start up an organization from scratch to a certain degree. One of the biggest challenges I think that we're very much interested in looking at is community engagement. A lot of the launching of the nonprofit was a result of the community indicating, look, we're being impacted by homelessness on a day-to-day basis, and we're tired of that. And so one of the things that we want to engage with the community is to both say, we absolutely understand your frustrations. All of the providers themselves live within this community. When we go to the grocery store and we see folks in the parking lot, or when I take my kids to the park and there's somebody living in the park, the playground equipment, that's a frustration, and that's real. What we do want to impress upon those folks, though, is that really those people who are experiencing homelessness are people, and that it's a condition, not something that speaks about that individual and the value of that individual. And so I think we need to do a better job of helping the community understand what their opportunities are, allow them opportunities for feedback as well to address homelessness, and to help us be part of the solutions too. Because the reality is that the solution in and of itself truly is simple. It's a home, right? A home for every resident in Kern County. But we don't have that supply currently. And so one of the things that we'll need the community to help support us in is as we are pulling folks off the street and engaging in a lot of sort of surge activity, if you will, we're going to need that support. And so that, I think, is one of the biggest challenges, is making sure that we're communicating with the community and that they have opportunities to communicate back with us.
So ultimately, we have to get housing in place to make home for these people, and then we have to get them into there and keep them there and help them transition. But you
That's
can't
exactly right.
transition until the homes are being built.
Yeah.
We talk a lot about the cost, and I know taxpayers have done it, and and people don't really talk about all the public costs of homelessness. I know every time somebody calls in a homeless person, there's the police, the fire response. Sometimes it requires an ambulance. Now the city is funding various cleanup projects. So there is just a lot of public money being spent. And I've heard some numbers, some places, what, $60,000, $70,000 because of the multiple calls on the same people per person on homelessness. And when we get them into a shelter, and even the cost you think of a shelter or a navigation center, which I'll get to in a minute, what the differences are, it costs money to feed them, and you've got social services there. And do you have any idea? The navigation center has been open for 3 months now, and they're providing mental health services and different things. What that costs on a per day basis versus when they were not in the navigation center, they were on the street. Do you have any kind of data on that?
I don't have any data for the last 3 months, but we do actually on our website have a cost benefit analysis report that describes pretty clearly exactly what you're speaking to, Michael, which is that the cost of someone experiencing homelessness is far greater. And a lot of times those are hidden costs. So it's not like the community member sees a bill for every time the paramedics are called out, or every time law enforcement is engaged, or every time code enforcement is asked to come out to address a particular need. We don't see that bill directly, but that is absolutely a cost. And what we know not just from our own analysis. And again, I encourage folks to take a look at what we have on our website, but it is certainly what national findings indicate as well, that even with supported housing, that cost to the public is far less than the cost of someone who is living on the streets or even living temporarily in a facility like a shelter or navigation center. It is far, far better for all of us as a community once someone is housed, and even if we're paying for supportive services at that point, having somebody stable is just so much better in so many ways. And it's a better way of, I think, investing public funds than some of these alternatives, which is to not do anything directly, but to have, you know, all of these various county or city services engaged in ways that are really Band-Aid solutions. They're addressing the issue in that moment in time, but they're not a long-term solution at all.
We've had homeless shelters in town for a long time, but now we have the new centers that are open are called navigation centers. Explain the difference between a navigation center and a homeless shelter.
So both provide a temporary place for someone to stay overnight. The difference, though, with the navigation center is that the navigation centers are meant to be low barrier. And what we have found is that there are 3 Ps, is what we call it, the 3 Ps that really prevent somebody from accessing shelter services. And that includes partners, possessions, and pets. And what the navigation centers are focused on is reducing the barriers to accessing services so that way the extensive case management that's provided there can really help pipeline someone into having the opportunities to access services and access a place to call home. And so the navigation centers, by removing those barriers, so for example, allowing your partner to come with you, having a place for your possessions. Remember, again, homeless people are just like you and me. And so our things are valuable to us, even if it's just in a backpack or even if it's in a shopping cart. And so asking folks to just dump all of their stuff in the trash, for example, in order to access a place to sleep, that's a barrier. And many folks are not willing to do that. And then the third P is pets. So when you are experiencing homelessness, oftentimes the entity, the companion that you have is, you know, a small dog or something along those lines that gives you a sense of hope and humanity. And again, most shelters oftentimes will not allow you to bring your pet or your possessions, or if you're have a partner, you can't bring that person either. And so they choose not to access those things. So the navigation centers are really meant to allow those 3 pieces to take place. You can bring your partner, you can bring your possessions. Currently, the M Street Navigation Center does not allow pets, but it is built up for that. The only reason that they're not able to do that right now is because of the unique conditions of the pandemic. But that's really what the purpose of those navigation centers is. It's meant to be extraordinarily temporary, get folks in, get them connected, and get them into greater stability faster and sooner.
Well, that kind of brings us up to what they are. So let's talk a little bit about the M Street Navigation Center, which is run by the county, and then we'll talk a little bit about the cities, which will open up in the fall. So the county started out with 25, March sometime?
I think it was in April.
April. It's been a couple months. And they allowed 25 to start with, and I heard they had that within a few days.
Yeah.
And they kind of got the bugs out, and now I hear they're at 50.
Yeah.
So what is their plan to get maximum build out, which I think is 150?
Yeah, I think, what's interesting is it's certainly, I have to give them a lot of kudos. It is very challenging to open a navigation center, which is really meant for group housing of folks under conditions where the way in which you keep people safe is to keep them apart and separated and isolated as a result of not wanting anyone to contract and a very serious infection. And so I think that they really, because they're wanting to focus on safety, started off slow and wanted to work out some of the bugs. They were working very closely with Flood Ministries, which is our primary outreach organization, and what we refer to as a by name list. It's almost like, you can think of it almost like a transplant list, if you will, but really those who are most seriously impacted by their experience of homelessness, we track those folks very closely. And Flood does a really great job of checking on their welfare. And then when available spots open up, they're able to get those folks into the navigation center or other spaces as they're available. So as I understand it, they'll continue through the county leadership and guidance, working with CAPK, who's the operator of the M Street Navigation Center. They'll continue to look and monitor, ensuring, again, everyone's health and safety. It's tricky if you've built up bunk beds and, now you need to have greater space in those sort of large dorm type rooms. It also impacts the COVID-19 pandemic also impacts your ability for how you can feed people. Typically that would be very much the buffet style line. And now you can't have as many people in those spaces. And so I think they're really wanting to focus on the safety of both the clients that are there and the staff members. Because the thing that we don't want, the worst case scenario is a significant outbreak. And when we start to think about the cost of taxpayers, a significant outbreak among people who have chronic health conditions, or may even be older, it both from a cost perspective as well as sort of a human perspective of, not wanting to have a negative outcome, those are the things I think they're very mindful of. So to kind of get back to your point, Michael, I expect that they'll continue to incrementally increase the number as they continue to be able to sort of monitor what's going on, every so often, make sure everything's safe. Okay, now we think that we've ironed out whatever the bugs may be, and then continue to open. That was their initial plan. They're just needing to do it a little bit more slowly now because we're under a really strange condition that hasn't happened in 100 years, right? So
yeah, I guess since the Spanish flu.
Yep, exactly.
Well, and how's the city coming along with their center? Are they on schedule to open up in the fall?
That is my understanding. I actually will be doing a walkthrough with them a little later. And as far as I know, everything's going well. They've already selected their operator, which is Mercy House, which is really exciting. We're thrilled to have them. We've heard very, very good things about them. And so I'm excited to partner with them and see what interesting best practices they may bring with them. And their intention is to be introduced at one of our next executive board meetings as well, so that we can start to form those strong partnerships. But yeah, as far as I know, the city is rocking and rolling on their navigation center as also.
Well, that's a good thing because we need to provide housing to get the people off the street. Because we really haven't heard about it. But I mean, I hear there's large encampments around people. They're kind of getting in groups than they used to be. There's not just 2 or 3 over here. There's bigger encampments now. So I guess that's a whole nother challenge.
Yeah, and part of what we have worked on with both the city and the county is the CDC guidelines for encampments and those folks who are living on the streets. And the guidelines continue to be that wherever is safe and practicable, that you do not disturb encampments, that you provide them as much as you can with PPE, with opportunities to practice, safe sanitation, but that the more you disturb people and cause them to move, the more you potentially spread the disease.
The more you
And
disperse the disease, that's right.
that's exactly
Shelter in
right.
place, shelter
Yeah.
in place, no
And,
matter what
and
that place
so
would be.
we know that that is taking place. We've been working closely with the providers to monitor the encampments, and we continue to form stronger partnerships with the city and the county. That when they are, when code enforcement, for example, is engaging those encampments and needing to make some changes to where they're located, that our outreach teams are going with them so that we can try to find them safer places to be, and potentially get them into stable housing and shelter as well.
Well, I think on that note, then we will say thank you very much for informing us and updating us on the status of homelessness in Bakersfield and Kern County. And so thank you for joining us today. It's nice to have you.
Thank you. It's always a pleasure, Michael. I love chatting with you, and hopefully we can continue to move forward and let folks know what's going on.
It's also good to see KLA graduates making a difference. Thank
That's
you.
right. I'm a very proud graduate. So
Thank
thank
you
you
very
very
much.
much.
To our audience, thank you for watching Conversations That Matter. We hope you found our efforts to be worthwhile and beneficial to your time. Please visit our website at kerntaxpayers.org under Contact Us to leave your thoughts and comments. Again, thank you for watching Conversation That Matters.